In space, no one can hear your bone mineral density erode 1 to 2% each month after spending 340 days in area, breaking an American file by means of 125 days. The NASA astronaut, again domestic from the International Space Station, touching down the previous day in Kazakhstan. Kelly even received a name from US President Barack Obama, thanking him for his provider, according to the White House. Space missions pressure astronauts to live and work in difficult environments humans are not accustomed or acclimatized to. However, brief time period stints of 1 month or much less have extraordinarily moderate effects, in step with the Canadian Space Agency. An area odyssey as long as Kelly's, however, carries with it extra sizable physiological stresses which can be frequently simplest felt upon go back to Earth. In the same way that each organ device desires to adapt to weightlessness, every organ system wishes to readapt after a long time period again to an Earth environment, Canadian astronaut Bob Thirsk previously instructed CBC News. Here are some of the outcomes space has at the human body. Bones. According to the Canadian Space Agency, astronauts can lose on common 1 to 2 in step with cent in their bone density a month, commonly in their legs. Bones are continuously reshaping themselves with regards to the stress positioned upon them, and loss happens in space's weightless environment due to the fact your body devotes much less power to construct a more difficult bone shape to fight gravity if it does not seem essential. Your bones are being usually eaten away and replenished. Bjarne Tryggvason, certainly one of Canada's first astronauts, told CBC in 2013. The replenishment depends at the actual stresses on your bones, and it is especially bones for your legs, where the stresses are all of a sudden decreased in space, which you see the primary bone loss, he stated. The extra bone count number is discharged out of your body through your urine, said Chris Hadfield. The first time you pee in area, your urine is complete of your skeleton, he said, all through a 2011 presentation to the Royal Astronomical Society of Canada. Astronauts are advised to work out for multiple hours a day and take nutritional dietary supplements and medication prescribed to submit menopausal girls to attempt to counter the bone loss. However, rehab remains wished. Thirsk, who underwent a 6-month space project in 2009, said it took about a year for his bone calcium degrees to return to pre-flight stages. End quote. The rule of thumb is for every month in space. It takes 2 months for the bones to get better, he said. Muscles and joints. Long-term area missions can reduce muscle tissue and power, once more due to reduced gravity, and again affecting largely the legs. Like the other of carrying a weighted exercise vest. Low gravity approach, less pressure for your muscular tissues, inflicting them to weaken. Astronauts can lose as much as 20 to 40% muscle length and characteristic for the duration of lengthy trips in area, according to NASA. The 2 hours they spend workout mitigates the deterioration to a point, however. Like with bone loss, astronauts undergo a rehab application when they're lower back on Earth to regain their muscle tissues and strength. Muscle-resistant sporting activities do not forestall the deterioration in our body, but it slows it down, said Thirsk. He also stated within 6 weeks of go back to Earth, he turned into able to get his muscle tissues returned to pre-flight fame. Astronauts also can undergo decompression illness, DCS, or the bends, in case you're familiar with scuba diving or early Radiohead, happens when the frame is going through fast and top-notch decreases in atmospheric pressure, which include resurfacing too speedy in water. It creates tiny nitrogen bubbles in the bloodstream and tissues, which causes symptoms starting from numbness to joint pain. Astronauts can get DCS via going from ordinary cabin stress. The ISS is pressurized to 14 psi, the equivalent to the atmospheric stress at sea stage, to a lower atmospheric strain, like once they move on extravehicular sports, EVA. To reduce risks of DCS, astronauts breathe 100 in line with scent pure oxygen for 1 to 2 hours at ordinary cabin stress, after which reduce the stress from 14.7 to 10 to 1 psi for 12 hours. Then after sporting the EVA mobility suit, they breathe 100 in keeping with scent oxygen for 1 greater hour earlier than going outside. Cardiovascular. Soon after being released into space, an astronaut's blood movements upwards from the legs to the higher frame and head. The frame's herbal response is to decrease the amount of blood in the body, and whilst an astronaut goes from zero gravity to normal or partial gravity, which include coming lower back to Earth from space, the decreased amount can result in brief low blood pressure. This affects the astronaut's motor abilities and can hinder their ability to do normal things, like walking or using a vehicle. And some astronauts might also faint after area flights. I had problem retaining blood strain to my head, and therefore I felt quite faint and dizzy, said Thirsk. In truth, I needed to have a transfusion of normal saline to get my blood strain up quickly when I got again. Astronauts also can experience heart and blood vessel problems down the line, which include artery stiffness, in keeping with University of Waterloo professor Richard Hewson. The astronauts came lower back from space with carotid arteries that have been about 20 to 30 years stiffer equal than what takes place with everyday aging, said Hewson. Increased stiffness of the arteries is related to elevated risks of coronary heart disorder and stroke. A 2012 study connected prolonged durations inside the zero gravity of area with eye abnormalities. Astronauts have complained for many years about imaginative and prescient troubles, along with blurriness following trips into area. And a NASA survey of 300 astronauts observed correctable near and distance imaginative and prescient troubles in 48, according to scent of folks who had short missions. In some instances, the imaginative and prescient troubles lasted for years after the astronauts back to Earth. The study advised the issues is probably because of fluid moving towards the head in the course of extended periods of time in microgravity. This could result in ordinary glide of spinal fluid across the optic nerve. Modifications in blood go with the flow inside the vessels in the back of the eye, or continual low strain inside the eyes, the researchers said. Stay connected with Space IQ for more such videos. Thanks for watching.